Second possibility is grabbing something heavy and feeling a pop in the shoulder, and then maybe noticing some swelling or bruising, and maybe even a little bit of deformity in the arm. And this deformity in the arm is some fullness of the biceps. We call that a Popeye deformity, and that usually means that you might have an injury to the biceps tendon, particularly a rupture of the biceps tendon. And when we say the biceps tendon, we talk about the long head of the biceps tendon, which is this long tendinous structure that inserts at the top of the cup. So the tendon actually comes there in the front of the shoulder and inserts right here at the top of the cup here, okay? So this is what it looks like. It forms the top, the labrum, which is this little bumper around the cup itself, surrounds the glenoid, and the biceps inserts right at the top. And what can happen is over time we can get some weakness and some tendinosis and some degeneration of that biceps tendon, and it gets very weak. And all of a sudden you grab something, it's excessive stress on that biceps, it pulls, and then you get a rupture right down there. When that happens, this retracts, like I mentioned before, muscles retract like a rubber band, and then you get a fullness here in the biceps muscle, and we call that a Popeye deformity. Depending on your work, your status, activity-wise, your age, and your expectations determines what the treatment method is. A lot of times, you can be completely functional with a biceps rupture, particularly the long head of the biceps. Distal biceps is different. That you end up with significant weakness of the distal biceps rupture, and that needs to be addressed most of the time surgically. The long head of the biceps can be addressed non-operatively if that patient is willing to accept the deformity in their biceps. But that is something to consider and have evaluated by an orthopedic surgeon, so please, if you have any of these symptoms, go see somebody and have it evaluated.